talk about the school age child. The school age child is generally defined as 6 years to approximately 12 years of age. They tend to have a slow physical growth, again, a little bit more slowed compared to our previous group of the preschooler. But what is different is they do have a rapid cognitive growth. Think about it, they're going to school, so starting six, kindergarten, first grade, we're really starting to get into that rapid cognitive growth. Height increases by 1 to 2 inches per year. Weight increases by 3 to 5 pounds per year. And by age 10, brain growth is complete. Maturation of systems, their IgG and IgA are reaching the adult levels. Their lymphatic tissue continues to grow in size until about age 9. Heart rate decreases to 70 to 80 beats per minute. Blood pressure is going to be about 112 over 60. And in later childhood years, what we're going to potentially see is scoliosis. So, really important to be making sure we're screening ahead of time. And if you think about it, one of the next topics we're going to talk about is puberty. It's happening at the end of the school age period. So, right before they have that big growth spurt because of puberty, we want to make sure we're screening for scoliosis. Right? So, all school age children older than 8 years of age should be screened for scoliosis. Sexual maturation for school age. We really start to talk about sexual maturation because one of the big things that's going to start occurring in the school age years and continues even into adolescence is puberty. So, what does that really mean? What does that look like? Well, puberty is considered the stage of life when secondary sex changes begin. We'll define what that really means in just a moment. The timing of puberty really differs. It differs between girls and differs between boys, certainly differs even within girls and within boys. Average age for girls is usually between 12 and 18 years, and for boys, 14 and 20 years. So there is a difference. You do have primary sex characteristics and you have secondary sex characteristics. So primary sex characteristics are those external and internal organs that are necessary for reproduction. Where your secondary sex characteristics, it's kind of like what I like to refer to as the aesthetics, things that make you look male or more female. So those secondary sex characteristics are a result of hormonal changes for your blank. Hormonal changes. So the voice changes, the hair growth, breast enlargement, fat deposits. They play no direct role in reproduction. No direct role in reproduction. And then when we get talking about the different types of hormones, there's estrogen and then there's also androgens. Males and females have a little bit of at least both. Obviously, depending if you're male or female, one of these levels are going to be a little bit higher than the other. So estrogen is the what we refer to as the feminizing hormone, feminizing for your blank. That is triggered at puberty by the follicle stimulating hormone or FSH to secrete high levels of estrogen. This is what helps to influence the development of the uterus, the fallopian tubes, and the vagina. Again, those primary sex characteristics, those external internal type organs to really start to develop. Estrogen also helps with closing the epiphyses of the long bones in girls, which the epiphyses are your growth plates. And then theal arc is what's considered the beginning of breast development, and that's usually 1 to 2 years before menstruation actually begins. Where androgens are considered the masculizing hormones. They're responsible for muscular development, physical growth, and an increase in the sebaceous glands that are cause or create the result of acne oftentimes. So for males, it's produced in the adrenal cortex and the testes. It's usually low levels until puberty, which is puberty begins around 12 to 14 years for the male. And for females, it's produced in the adrenal cortex and the ovaries. One thing I usually suggest that you have a grasp on is knowing what that puberty sequence is. Because when we're educating children about what's going to happen to their bodies, we want to make sure they have the proper information. So knowing boys and girls sequence might be a good thing to know. So for girls sequence, this is just kind of the simple down and dirty of it. They go through a growth spurt. They have an increase in the transverse diameter of the pelvis, which really just means their hips widen, right? They get wider hips. Then they have breast development, growth of the pubic hair, onset of menstruation, then growth of axillary hair, and the last thing being vaginal secretions. Where the boys sequence, a little bit different, they have an increase in weight first, then growth of the testes, growth of base, axillary, and pubic hair, voice changes, penile growth, then an increase in height towards the end, and production of sperm is the final part of that sequence. Talk about developmental milestones in the school age children, starting with gross motor development. Really, overall, what I want you to get from it is we've hit a lot of those big milestones. Really, at this point, we are just now refining those gross motor skills or development. They're becoming more refined. We're not so clumsy. So don't memorize the individual ages. I just kind of tried to show you kind of progression of what will happen. So again, at the beginning, the 6-year-old is still lots of energy, just constantly jumping, tumbling, skipping, hopping, constant movement, right? And then by age, if you go to the third page, by age 12, they're really getting into activities with intensity and concentration. That could be formal sports activities, recreation type their activities, but they're really channeling that energy and the activity, and they have an intensity about it. So they start to really become a lot more competitive too. So again, overall, school age children, we've hit all the big milestones, and the other age groups we're really just refining that gross motor development. Fine motor development for the school age child. Again, fine motor development is just becoming refined, getting a good grasp. They've already started learning how to write letters typically in preschool, but their writing skills are becoming more improved. They have more focus with that. So again, don't memorize the exact year, like a 6-year-old does this, a 7-year-old does that. You'll drive yourself crazy. I just want you to have like a basic understanding of what that progression looks like. And those of you who have kids, you've probably seen it. When they first started writing, wasn't the prettiest, really sloppy. Where over the course of those school age years, that really becomes a lot neater, a lot smaller, not these large, really kind of shaky letters. It's a much neater, smaller print. And again, that is just more refined. They often refer to, especially school age around age 7, as the eraser year. They're never quite happy with their content or how they've written it, so they're constantly erasing. And I would say that hangs around for a little bit while, but then once you get to that older school age child, much neater writing. Play for a school age child. Again, I don't want you to memorize the individual years for that box. Again, have a idea of what that progression for play looks like. In the beginning, young school age children enjoy being active, doing sports, recreation type sports. They find reading enjoyable because they've learned how to do it. They may even spend plenty of time or lots of hours doing video games or puzzles or things like that. By age 7, they're starting to really require more props. Reason being, they're losing that imaginative and imitative thinking, that magical thinking that they had as a preschooler. So they need more and more props to make it feel real for their whatever play they're doing. They're also getting into collecting items. And then that progresses on even into age 8. Once you get into later school age, especially even 9, they're starting to be a little more rough and tumble with their play. Getting into music and music lessons, playing an instrument. And by 11 and 12, they're very interested in popular music and dancing, playing table games, spending time with friends, maybe doing small jobs to earn some money as well. Language development in the school age child. Their language development, they're really have pretty good array of speech. They're talking in full sentences. They're using language very easily and with meaning, especially the young school age, like under 6. They're still defining those objects by how they use them. So again, if you ask them, what do you use a spoon for? It's something I eat with. They're not going to define it by those characteristics. By age 7, they're able to tell time and hours. but they do struggle with those concepts of quarter till, half past. Um, that's a struggle. That is not a concept that they've mastered yet. They know their year, their months. They know where holidays fall. They can do um, addition and subtraction, and they're learning how to make simple change. Where by 12, they're carrying on a full adult conversation. And I skipped right over 9. By 9, they're often starting to learn jokes, even dirty jokes, using swear words, sometimes as a way of kind of showing off, um, or just, when they're displeased with something. It's kind of their way of trying to assert themselves and make themselves feel a little bit older too. Their social emotional development, they really like to learn to accomplish small tasks independently. They like to do things independently. A lot of that is helping them to gain a sense of autonomy. It also kind of helps with that self esteem, a sense of self worth. They really like to learn how to do things, and they like learning how to do things well. School age children need a lot of reassurance that they're doing things correctly. So, again, having consistent praise or like, you're doing a good job, that's right, keep it up. They like those things. That helps them to kind of reassure they're on the right track with whatever it is they're trying to do. And that's best too if that comes, again, immediately after a task is completed, or if it's something that takes them a little longer, um, doing it throughout, like whatever the steps may be. They also get a sense of accomplishment from finishing a task, and especially learning something new. So we really want to encourage that. That helps build that good self-esteem, a good self-image. So definitely positive reinforcement is the best thing for them. Let's talk about promoting school age safety. Again, go back and look at the box in your ebook about safety measures and prevention of unintentional injuries during the school age years. When it comes to motor vehicles, they should be still riding in the back seat, using typically, like in this picture, like a booster seat like that, and now using maybe the seat belt from the car. And if once they've kind of outgrown that type of booster seat, then they can go to a backless booster seat. I believe that is up until at least age 8. They're actually probably even encouraging, I've seen some say up through age 12, 11 or 12. But it really depends individually on the child and where, if they're using the seatbelt from the car that has like a shoulder strap, where does that hit them? Because without the booster seat, sometimes they're sitting too low. So it really depends on the individual child's height as to when you can get them out of some sort of booster seat altogether. But definitely riding in the back seat, wearing safety belts, things like that. Bicycles, again, wanting to make sure they're being safe if they're riding out in the street, they're wearing a helmet, they know to look for cars before crossing the street. Again, looking at burns and falls, sports injuries, making sure they wear proper protective equipment when they're playing sports. Drowning, again, they should, even if they know how to swim, they've had swimming lessons or have been taught, they should still have some supervision with that. You'll see a couple new ones in here, drugs and firearms. We definitely have to be talking about drug safety and prevention, and making sure that as parents or as caregivers, they are taking necessary measures. Kids during the school age period, probably more so middle to late school age, we start to worry about them getting into prescription drugs or getting into and possibly illicit drugs. If you think it's not happening, it does. It happens probably more than you know. Kids get curious, they try things, peer pressure. So definitely having those conversations about saying no to drugs and not just trying something because of peer pressure. So remember back in the day when Dare was really popular, there was that whole push about just say no. So um, kids are doing sometimes some unusual things with drugs, where they are doing what they call fishbowl parties, where they just dump a bunch of drugs into a bowl or a fish bowl and at parties, and then just take a handful. They don't even know what they're taking. So got to have those conversations, lock them up, um, not having them out. They'll try sometimes anything. It doesn't even have to be a prescription drug. The other thing, we need to be talking about firearm safety, making sure that we have guns that are not loaded in the house, that we have guns locked up securely or gun locks on them, keeping ammunition and the guns separate. Again, keeping those items locked up out of reach of a child, keeping the key um, somewhere safe where the child can't get hold of it and potentially get into the ammunition and the guns. So, again, look over those common safety measures. What really is talking about that in the school age years, there's not as much direct adult supervision for the child. So, safety talks, making sure we have good education for the child, and talking about safety practices is really important because, especially as they get into the older school age, they're probably going home maybe by themselves for a few hours, or certainly being trusted to stay home for a couple hours, maybe while parents run some errands or go to the grocery store. Or they're certainly, if they're in a neighborhood, going unsupervised down to their friend's house or somewhere else or a playground that might be nearby. So, those are important things to be talking about safety practices, making good choices, and having those conversations with them. So, definitely look at also teaching points and how to help children avoid sexual maltreatment. You're talking about promoting nutritional health of the school age child. Nutrition is just as important as it is in any other age group. Even during the school age years, we really want to promote an importance of a balanced diet to promote adequate growth. Even though they are still growing slower, we just want to make sure the nutrition they're getting is good balanced diet, not too high in fat or sugars and things like that. So the big thing too, the big change is because kids are going to school, parents aren't able to monitor their diet as much when they're away from home because again, like they said, they're at school. If they're not packing the lunch for them, they're relying on what they get from the school cafeteria and those choices. And um, even with my own daughter, we've had to say, hey, you can only get something special once a week, not every day, because usually the specials that she can get aren't anything healthy. They're chips, they're um, popsicle or things like that. Something that we don't want her having every single day. Of course, she would if she could, but so again, having those conversations and urging healthy snacks. Also, when they come home from school, again, as they're a little bit older, they're probably not being supervised if they're going home to an empty home or for a few hours. So, having healthy snacks and really you're encouraging that. So, fruit, cheese, and milk rather than cookies or soft drink because we don't want to develop those poor eating habits. We know poor eating habits lead to long term consequences, especially increases that risk for type 2 diabetes, hypertension, cardiovascular disease, and obesity. So we really are trying to decrease those things early in life and set up good, healthy behaviors. Um, Again, get kids to help prepare those healthy snacks. So simple things they can do jello, salads, a sandwich, or something like that. Um, Also important, especially when we hit that growth spurt with puberty, make sure that they are getting the right kind of requirements that they need for growth. So they do have an increasing energy because of those growth spurts that are going to occur. And they often require more iron in pre puberty. So, right before puberty starts, they'll require more iron. Promoting development of daily activities in the school age child. When it comes to dressing, they're able to fully dress themselves. They're not skilled at taking care of their clothes typically until about late school age. They tend to, when they take their clothes off, they're usually inside out. They're not always picking them up and putting them necessarily in a laundry basket or a hamper. It's just kind of wherever they go. So that is something they learn really in the late school age years. They definitely have opinions about their clothing styles. They don't often like what parents are necessarily picking out for them anymore. They really base a lot of their likes on what their friends have or what's popular in sports or a popular musician, again, rather than the parent's preference. When it comes to their sleep, the younger school age child, so we're talking typically like your 6 to 8, 9 year old, they're really requiring 10 to 12 hours of sleep per night. We tend to see night terrors common, especially with the early school age child, especially related to starting at school, or stress that may bring about with starting school. Um, Younger school age children really do enjoy some quiet talk or reading before bedtime, again, kind of helping them wind down and set that tone for sleep. Where older school age child, so typically more like your 10, maybe 12-year-old, they're requiring about 8 to 10 hours of sleep per night, and they'll generally give up those, they're ready to give up those bedtime talks with parents, and preference, of course, with communicating with friends by phone, text, whatever that may be. It is important to make sure we're limiting the amount of TV time and screen time, whether that be a phone, a tablet, or an iPad, or something like that. We want those out of the bedroom because we know that that contributes to shortened sleep times, which really can affect school performance and just overall mood and health. So try and eliminate those things from the bedroom, or certainly put time limits on them, in order for them to get the adequate amount of sleep that they need. When it comes to exercise for the school age child, no different than anywhere else. We want them exercising, get them out there, get them moving. Again, it doesn't have to be really rigorous or structured exercise. We just want them up and moving. So encourage them to get outside, go play, go take the dog for a walk. Um, Again, it doesn't have to be through organized sports, but that is certainly one way, whether it be a rec league or getting into more of the competitive type. Again, it's an opportunity to be moving and about. And if you think about it, one of the big pushes that we have from the NFL is the Play 60. It's all about get out there and go move for 60 minutes a day. So think about gym classes and things like that, recess time, really cut back maybe compared to when you were a child. With those things going away, it's more important than ever to get our kids out and moving. And again, technology too sometimes hinders that exercise. So, again, promoting them to get out, go play with friends, go walk the dog, ride a bike, do something to get moving. And the last thing in this, or on this slide about daily activities, hygiene. Usually, that young school age child, the 6, 7-year-old, they still need help regulating their bath temperature, need help with making sure they get their ears clean, their fingernails clean. By 8, they're usually capable of bathing themselves. May not always be to like your standards. So again, occasional assistance, but they are capable of bathing themselves. I know, like for my daughter, she has a really hard time getting conditioner rinsed out of her hair well. So oftentimes I need to go back and like re-rinse it. Uh, but she can bathe the rest of herself just fine. So oftentimes they just need little help here and there. By older school age, they're showering on their own, no assistance. Boys and girls, especially, are interested in showering as they approach those teen years. Guess what? Puberty, right? So, as they start to have perspiration that comes with puberty and body odor and the sebaceous glands, you really see it, especially when they're interested in someone that the hygiene tends to pick up a little bit better. I like to think about those middle school years as kind of like the stinky years where we're not necessarily quite real great at hygiene. Um, their hair is a little bit greasier. They tend to have body odor a little bit easier. But again, that's just part of growing. They'll eventually get better. Often, again, need a little reminder sometimes, like, hey, you need to go get cleaned up. Make sure you wash really good, get all that oil out, and put deodorant on and things like that. Talking about health promotion for the school age child. Health maintenance and promotion, by now, again, they're still continuing those yearly checkups. And there's a long list of things you can see in your notes. I'm not going to go through all of them, but typically a lot of the same things we've been doing, still doing kind of a health history, updating that, getting the physical, still talking about growth and developmental milestones, things to expect in the coming year. We're screening for that hypertension. Remember, we said we start doing blood pressures at the age of 3. Still talking about nutrition, making sure proper nutrition, right? Parent-child relationship. A couple new ones, again, scoliosis. I hit that, kind of talking about that in the beginning of this chapter. Scoliosis, we should be doing or screening for that yearly after the age of 8 because we know that they're going to hit that growth spurt with puberty, and we want to make sure we catch it early if possible. We do start checking thyroid as well. That can be done every visit after the age of 10, and certainly looking at lipidemia levels. So we do that around 6 to 8 screening, and then somewhere between 10 and 12 years of age. We can also be checking for bacteriuria via a clean catch. Anemia, if that is a concern, especially if we're seeing changes in, how tired they are or school performance, that could be certainly a contributing factor, and we could screen for the possibility of anemia. Again, immunizations, those are always happening. A lot of these are usually around the 11, 12-year mark. I'm not going to test you about immunizations for school age, but I still like to include them because immunizations are still happening even during in the school age year. And besides those 11, 12-year shots, influenza is being still promoted yearly as well. And of course, dentistry guidance, just like we've talked about in the other age groups, we're still doing that, just geared at the school age child. Still talking about those expected growth and development milestones. I've already hit on that. Talking about unintentional injury prevention, so really getting into safety. And then, of course, addressing any parents or concerns the caregiver may have. Dental health in the school age child. Their eruption of their permanent teeth are occurring. So they're losing those baby teeth or deciduous teeth, and we're starting to get their permanent teeth in. We want them to be getting dental visits every 6 months, just like they should have been doing. And of course, having good dental hygiene, brushing those teeth, flossing. When they're brushing, making sure they're using a fluoride-based toothpaste and brushing a couple times a day after meals. And of course, dental flossing is important to incorporate. Again, trying to prevent dental caries as well. One issue that could also come up with when it comes to dental health in the school age years is malocclusion. Malocclusion is just simply when the upper and lower dental arches do not approximate in the proper relationship or alignment. It could be due to hereditary habits like thumb sucking or tongue thrusting, where they're pushing their tongue forward against their teeth. It usually requires orthodontic treatment, so if noticing it, certainly get them referred to an orthodontist early on. It's most successful if that started by the late school age or early teenage years after that last primary teeth have been shed. So again, referrals made as soon as possible for evidence of malocclusion. Concerns and problems with this during the school age period. There's two important ones that we tend to see during the school age period, and that's attention deficit hyperactivity disorder and autism spectrum disorder. Other problems might be concerned with language, some fears, and responsibility. So with language development, the most common problem is, for your blank, articulation. Articulation. So they have difficulty pronouncing certain syllables. One example is they may substitute W for the letter R. So they often will end up saying West Room instead of rest room. That'll usually disappear by the third grade. Not a usual common concern that can't be worked through. It may require speech therapy, but most kids, that will typically disappear, like I said, by the third grade. Some common fears and anxieties, especially for the school age child, anxiety related to beginning school. It's a big change depending on where they were going prior to that. If they were, which in our state, pretty much everybody does full-time kindergarten, but maybe when you were a kid, you only went half a day, or your kids went half a day, depending on how long ago that's been. But transitioning from, a partial day or like preschool that's only a few days a week to going to school 5 days a week all day long, that's pretty tough. We also tend to sometimes see school refusal and phobia. Those kids, we usually start to see a development of some physical signs of illness. That could be vomiting, diarrhea, headache, complaints of abdominal pain on school days. And it could be related to maybe there's a bully in the class or at school, or maybe they feel like a teacher is picking on them. There's lots of different reasons, or something they're usually trying to get out of. So if you're, planning on becoming a school nurse, or you're working with a school age child, and there's usually a pattern to like the time of day or the same type of complaints that as to why they don't want to go to school, or maybe a particular class they're trying to get out of, start asking some questions and looking at that patterns of behavior, because it certainly needs to be investigated. And then the last topic we're going to talk about in this is children who spend time independently. School age children, especially the older school age, more and more are staying home alone, even for If it's a short amount of time or extended amount of time, doesn't matter. If they're at home alone, we tend to see an increased number of unintentional injuries, delinquent behavior, alcohol or substance abuse, and even decreased school performance because there's just simply not a lack of adult supervision. So, because of those types of things, certainly we've seen the use of after school programs, boys and girls clubs, to really try and curb some of these problems. So, again, with unintentional injuries, a lot of what's happening is, again, they're not seeing how they're in danger. So, again, accidents are happening because they're falling, or again, gun safety. They're getting hold of a parent's gun. That's again why it's so important to make sure those things are locked up and never a loaded gun is kept in the house, as well as like alcohol, substance abuse. That could be prescription drugs, that could be illicit drugs. Again, kids today face a lot of stresses and struggles, and unfortunately, sometimes they feel like they have no way out, so they turn to obviously things that aren't safe. And I mean, I've seen kids come in with Tylenol overdose, where they'll take a whole bottle of Tylenol or try and cut themselves. It's really scary to think about, and getting them the help they need. They often feel like they can't go to a parent or a counselor to talk, and that's really what they need. They need someone to talk to and support them about all the stresses that they are experiencing. So again, there's lots of different things that have come about those after school programs to keep kids safe, engaged, not going home to an empty home. There's also community hotline if there is something that happens for a child they can call. It might also be helpful to look at um, tips on children who do spend time independently and their parents. So you could go look at that box as well. Sex education for the school age child. Yes, we do need to be talking about sex education in the school age child. Again, depending on the age and the developmental level that the child's at, that needs to match what that education looks like. But they need to be educated, especially about the puberty changes and responsible sexual practices. So for preteens, they need to be having or need to have an adult that they can turn to for questions and answers. And ideally, we want that to be the parent. Some parents aren't comfortable having those conversations or don't want to. The sad part is if they don't feel like they have a trusted adult or parent to turn to ask those questions, guess where they're going to try and find the information? Their friends, the internet, and God forbid what they could find on the internet. And they don't always realize that everything out there on the internet isn't true. So it's scary the things they can get into. So again, we really want to encourage them to go to their parent, but sometimes parents just shut them down. We want to make sure they're getting accurate information. So maybe a healthcare professional is another good resource. It's really important, or it's best if sex education is incorporated into health education classes throughout those school age years, and it's appropriate to their age and their development, like I said before. So, some topics to discuss with both pre adolescent boys and girls, talking just simply about reproductive organ function and physiology of reproduction. We want to make sure they understand what's happening with their bodies, what's happening with menstruation, and why it's occurring. Talking about secondary sexual characteristics so they understand again what's going to happen to their body, what are those changes they're going to see and feel. For males, talking about male sexual functioning, again, why the production of increased amounts of seminal fluid leads to nocturnal emissions. We want to be talking about physiology of pregnancy and the possibility of unintended pregnancies, and that can come with sexual maturity, or certainly if they start experimenting and having sex, that's certainly a risk that they are at. And if you think a school age child, they're not having sex, it is happening younger and younger. So it is a little scary as to some of the things that they're getting into. So we want to be talking about that. What is responsibility, safe sex practices, which really try and promote waiting and don't let peer pressure get to you. Again, STDs and things like that. So taking those proper measures for safe sex. Violence or terrorism when it comes to the school age child. School age children really view their world as safe. Um, there's some common recommendations that we want to talk to parents about, and how to help them assure that their children are safe, or help parents talk to their children about that they are safe. Um, Children pick up on a lot of things just listening to the radio when they have little news stories on, or certainly if you have the news on at home. And even when you think they're not really listening or paying attention, they pick up on a lot of those things. So be careful what it is they're exposed to. And if they are watching a news program and they're talking about terrorism or some other, violence and things that are happening out in the world or their community, make sure that you are explaining those things to them, because they don't always understand that it's not close to home, especially if it's somewhere else in the world, or if it is talking about somewhere that's in your city. They don't always understand where that relationship or that relation is and to where they live in their community. So definitely be having conversations with them, and maybe not watching the news until after the child has gone to bed, because it can become upsetting and stressful for the child. So you want to observe for those signs of stress, such as sleep disturbances, fatigue, lack of pleasure in activities that they once enjoyed, and signs of beginning substance abuse. Again, sometimes things that are going on, kids will turn to drugs or alcohol. Again, don't let children or adolescents view traumatic events. And if you are, you know, have those conversations. Sometimes it just means turn it off, turn the channel to something else, and explain that there are bad people in the world and that bad people do bad things, but that you're certainly doing as a parent, trying to do everything to keep them safe, and not letting anything bad happen to them. Another important thing to think about is just having a family disaster plan, depending on obviously where we live. And being in Indiana, if there was a tornado, what do you do? If there was a fire in the home, um, how do we escape safely? Where's our meeting point? So, designated those things and actually practicing them as a family, not just having conversations, are all important parts. Bullying. Bullying is really common in the school age child. It is a frequent reason that school age children cite that they feel unhappy and that they often turn guns on their classmates, or they commit suicide or attempt suicide. So, again, really watching out for some of those signs. Parents need to be alert about internet or texting, um, because both are possible. In this day and age with electronics, bullying is no longer taking place face to face. There's cyberbullying. Um, so those are things to be thinking about, or certainly watching for, kind of monitoring if your kid has a device or a phone, um, or if they have a social media account, making sure you're still kind of policing those as a parent to look for bullying in both ways, whether it's being done to them or they're doing it to someone else. Some suggestions for school personnel to deal with bullies can include supervising recreation periods a little more closely, intervening immediately if there's bullying going on to stop it, insisting that behavior needs to stop and both the school and parents should be involved, advising parents to discuss bullying with their school age child, and helping them to understand it should be reported, and allowing adults to intervene. And again, I already said parents need to monitor social media and texting interactions between their child and other children. Recreational drug use, and it's once was considered something that was really occurring in college or even high school, but unfortunately we are seeing it younger and younger. Kind of talked about that a little bit earlier. We're seeing illegal drugs available to children in early elementary. It's certainly probably being exposed to them by 7th, 8th grade. So commonly abused drugs are alcohol, um, inhalants, and prescription drugs that we're seeing. So it can also be over-the-counter type things. It's amazing what they can get their hands on. Parents need to be particularly aware of children who may be taking an adult's antidepressant drugs from home cabinets, because that's often associated with suicide in young children. Cigarette smoking can begin in school age children. We really want to caution children against experimenting with smokeless tobacco or e cigarettes. We've seen obviously a big rise on e cigarettes and vaping, increased health risks with those problems. And again, we still don't know all those health risks or what the long term risk of those are. So I'm really trying to get kids to avoid those things if at all possible. All right, the last topic we're going to talk about is overweight or the obese child. As many as 50% of school age children are obese by body mass index guidelines. 50%. That's a large number. And there's certainly a lot of talk about making sure we have healthy meals in the school lunches and things like that. The reason why we are seeing overweight and obese child as young as school age, it is, I mean, it can be younger than that, but why we're seeing such a large percentage of school age children, a lot of those families rely on fast food meals for your blank, fast food meals several times a week. Those fast food meals tend to be high in calories, high in fat. Why are they relying on those? Simply, it just has to do with the number of activities. Um, Sometimes it's a matter of cost, or they're constantly on the go because they're running between different activities with different kids. So we really want to eliminate those as much as we can, or trying to make better choices. Um, Soft drink machines used to be in grade schools. I think they've really probably cut back on that quite a bit at this point. Um, but that could still be a possibility as well on an occasion. And usually by the preteen years, obese children will develop the same health problems as an obese adult. So hypertension, type 2 diabetes, elevated cholesterol levels. They can, especially being a child, they can be ridiculed or bullied for their size. Um, Maybe unable to participate in sports teams, which can tend to lead to all those things, can really tend to lead to poor body image or self image. They often don't have as much motivation for self improvement. One of the things that we do teach if there is a child who is overweight or obese is looking at weight reduction programs. Those really are the ones that are probably going to work best, and that's because they emphasize long term lifestyle changes versus the short term. We don't want kids doing fad diets or reading books about the latest fad diet. Those are really not healthy. They're really aimed at short term goals to lose weight very quickly. But guess what? As soon as you stop doing that fad diet, what happens to the weight? It usually comes back, and sometimes even then some. So we really want to focus on long term lifestyle changes. What you'll see, we're going to talk about obesity not only in school age, but we'll also talk about it in adolescent as well. But you'll notice a difference about the amount of calories. So for a school age child, they need about 1,200 calories per day, where adolescents going to need a little bit more, and that has to do with growth. So school age is not growing as, they're not hitting that growth spurt as much, or growing as fast in general. So they only need 1,200 calories per day. For your blank under there, we want to emphasize lifestyle changes. Lifestyle changes. Having structured family mealtime. Sitting down at the dinner table. Not running through the fast food and eating in the car on the way to an activity. Sitting down as a family and having that structured mealtime. Really trying to eliminate eating and snacking in front of the TV, because we all guilty. If you just grab a bag of chips or a container of cookies versus getting out a small portion and you're watching TV, next thing you know, half the container or bag is gone. And that's just not healthy. And it's because we're not paying attention to portion sizes. We're distracted and things like that. So really try to eliminate eating and snacking in front of the television. Big pieces, we need to decrease our portion sizes. In our country, in America, in our culture, our portion sizes are huge. You go out to eat, it's usually 2 and 3 times really what we need. But we'll be darned if we're going to let that go to waste, right? And so we really need to decrease those portion sizes to making sure they're adequate for what they need and not more than what they really need. Eliminating those sugar-rich drinks. So juices and pops that are high in sugar, get rid of them. They don't need that. Trying to really drink probably more water. And the other thing we want to encourage is an active exercise program. Active exercise program. If they weren't getting up and moving before, they certainly need to now more than ever. Again, that's going to help instill that healthy lifestyle, hopefully, more long term benefits from that, and setting in long term healthy lifestyles. So, monitoring and limiting the amount of physical inactivity. So, again, just sitting in front of the TV or playing video games or whatever type of screen time, limiting that, um, and really get them moving. Again, it doesn't have to be structured activity all the time. We just want to move in. In some cases, we may also need to have a counseling program to help with self image and motivation to reduce weight. Again, trying to caution children to not try fad diets. Yeah, they work in the short term, but they're really not healthy. It's not a healthy way to do it. And we want to focus on small goals, right? So think about back when I talked about school age children really like to be able to accomplish tasks that gives them a sense of accomplishment. Well, I don't care how much weight they need to lose, even if it's 50 pounds, 25 pounds. Don't start with that as the, goal, because they get discouraged just like you and I might get discouraged real easily. It's easier to focus on, let's work on losing 5 pounds, right? Because that's more manageable. And we get a sense of accomplishment from losing that 5 pounds and like, all right, now let's lose another 5 pounds or let's shoot for 8 pounds, right? So making it smaller goals. And we certainly don't want to jump to surgical techniques. These kids are still growing. We don't jump to those lightly. I'm not saying it can't be possible, but that's really not something that we do in school age children because they are still growing so much.